Right. So I think we've got everyone added in. So welcome everyone. I'm Zach Young, one of the board members of the WPC, and we have a great program today. But first of all, um, if you want to figure out other things we have going on coming up, upcoming programming and CLEs, if you go to WPCTN.com, you can find that. And if you are registered today to get a CLE, don't worry. At the conclusion of today's programming, we will get that turned in for you. And now I want to introduce our great panelist and moderator. We are really lucky today to have Heather Michelle, who's an attorney and lobbyist, who's worked for over a decade in public policy and government relations on both local and state levels, collaborating with lawmakers, nonprofits, law enforcement, judges, and advocates focusing on the criminal legal system. Her work centers most notably on victim advocacy, professions of healing hearts, and reproductive justice. Heather believes advocacy work should be grounded in trauma informed and harm reduction frameworks, and that no one is defined by their worst moments. Her previous work in the victim advocacy space cultivated her trauma informed approach and opened her eyes to the sexual assault to prison pipeline. We also have Tennessee State Senator Heidi Campbell, who's a Nashville native, a mom, a former music industry executive who made history as the first female mayor of the city of Oak Hill. She's widely recognized for her leadership on issues that matter to Tennesseans, including fiscal accountability, equity, local business development and environment, education, social health, and the well-being of women and children. In the state Senate, Senator Campbell brings a compassionate, data-driven approach to policymaking. Her current legislative priority is the Tennessee Waste to Jobs Act, a transformative extended producer responsibility initiative that will generate more than $300 million for recycling infrastructure and education at no cost to taxpayers. She has served as chair of the Davidson County delegation and currently sits on several key legislative committees, including fiscal review, agriculture, energy and natural resources, and transportation and safety. She also serves on the Tennessee Advisory Commission on Intergovernmental Relations, TASER, and is the state lead of the Environment Committee for the Southern Legislative Conference. And most importantly, she's my state senator. And finally, we have our moderator today, Rachel Freeman, who is a licensed clinical social worker and the president and CEO of the Sexual Assault Center. Rachel began her career at the Sexual Assault Center in 2001 as an intern, completing her master's degree in social work. She worked as a therapist before assuming the role of clinical director, then vice president of programs, and finally as president and CEO in January 2018. Under her leadership, the Sexual Assault Center has doubled in size in the last few years, growing to an agency of 55 staff members. In 2018, they added on this SAFE clinic, Middle Tennessee's first non-hospital setting for medical legal rape exams. The center now serves approximately 1,200 children, adults, and families each year and also works to end sexual violence through training and prevention programs. Rachel has received awards and accolades, such as being named one of the Tennesseans People of the Year, receiving the Tennessee Visionary Voice Award from the National Sexual Violence Resource Center, and being recognized by the Nashville Business Journal's inaugural Leaders in Diversity Awards. And at this point, I will turn it over to Rachel. Thank y'all for joining.
Thank you so much, Zach, and thanks so much to everyone for joining today. I'm going to jump right in because we've got a great conversation to have today and want to be very mindful of time. If you have any questions, please feel free to drop those in the chat at any point, and Zach and I will do our best to keep up with them and make sure we answer as many questions as possible. But I wanted to set the stage a little bit about why we're having this conversation and why it's important for us to talk about. Across Tennessee right now, access to rape kits for minors is a little bit challenging and controversial and often difficult because of a new parental consent law that went into effect in 2024. And the legislative attempts to fix it have not yet been successful. So in Tennessee, in 2024, the Families' Rights and Responsibilities Act was passed. And this act mandates that parents must consent to all physical and mental health treatment for their children without explicitly including or excluding rape exams. So this means that in order for a minor victim to get a rape exam, this law can be interpreted that parents must give consent. And we know that in many cases, often as many as 90% of sexual abuse cases with minors, it's often someone within the family who has done the abusing. So this presents a unique challenge for minor victims, particularly teenage victims. The overarching problem is that now a time sensitive rape exam is being delayed or denied in many cases across the state, risking justice and well being for these young minors. Here in Nashville, we have the SAFE Clinic at the Sexual Assault Center, and we provide rape exams for anyone 16 and over. We are continuing to provide the exams because there are a few different ways to interpret the law as it is right now. And there is also a center called Our Kids here in Nashville, and they provide exams for children who are 16 and under. They do forensic exams for those under 16. There are other locations across our state, and each one is interpreting the law just a little bit differently. So that's why this is an important conversation to have. So I'm going to give our first question to Heather. Heather, can you start by helping us understand the legal landscape in our state regarding minor access to rape kits without parental consent?
Yeah, thank you, Rachel. As you mentioned, parental consent really hasn't been an issue before the passage of the Family Rights and Responsibilities Act of 2024. And typically, when a minor is presenting for a rape exam, they are doing that most often as a referral from DCS or law enforcement. And those minors would go to Our Kids, as Rachel mentioned, or Child Advocacy Center. So there's multiple ways a minor could access a rape kit. That's one, a referral through DCS or law enforcement to Our Kids or the Child Advocacy Centers. And that's typically the way you see minors who have been assaulted kind of going through the system. If a minor were to show up at an emergency room, they would typically receive a rape exam at an emergency room at most of the hospital systems if that hospital system has a SANE nurse. That's a sexual assault nurse examiner. So when we talk about some of the barriers in a little bit, SANE nurses and accessibility to the rape exams is a continuing issue that our state struggles with. But if a minor would show up to an emergency room and there was a SANE nurse, they could get that rape kit at the emergency room. And then typically there would be a contact to DCS or law enforcement at that point. And the one that's really the third option that's really caused that there's a lot of confusion around with the new law is a standalone clinic. Like the Sexual Assault Center in Nashville, there are a few other clinics across the state that are standalone, meaning they're not attached to an emergency room. And so if a minor were to walk into the standalone clinic for care, it would really depend on that clinic's interpretation of the law. Now, the Family Rights and Responsibilities Act has definitely caused some confusion, as Rachel mentioned. There are some explicit exceptions in that law. One is for mental health treatment for 16 and 17-year-olds. That's explicitly written in there that if you're a 16-year-old or a 17-year-old, you can receive mental health treatment without parental consent. Another exception is emergency treatment. So if you're going into an emergency room, you might be able to access that kit, that rape kit, through the emergency treatment exception in the law. There's also a provision that allows for an exception to record a minor if they are doing a forensic exam. That might be the interview process, the recording of the child's, the minor's testimony. So it gives explicit permission for those things. However, as Rachel mentioned, there is no explicit permission to access a rape kit without parental consent. And so that's where you see these different uh, clinics or nonprofit groups providing this that are really struggling with the interpretation. Another thing I think the healthcare providers are relying on, not only the emergency treatment exception within the Family Rights and Responsibilities Act, but the mature minor doctrine, which you all have probably heard in the news has been amended over the past few years by the legislature, specifically around mature minors' ability to get COVID vaccinations and to get abortion care. Those two things in the mature minor doctrine have been limited in the state, but that doctrine still exists in case law that could potentially provide protection for minors to access rape kits. However, without a clear, explicit exception in the law, there's just varying degrees of interpretation on a clinic's ability to do so.
Thank you so much for that, Heather. You touched on some of the unique barriers that this legislation has and current laws have created for minors, for young survivors of sexual assault. But are there any other barriers that you would like to touch on now that make it difficult for accessing this timely care?
Yeah, absolutely. I mentioned the same nurses, and actually, Senator Campbell and I were recently discussing this, but not every hospital has a sane nurse. And so some of you may remember, I guess this was about last year, Rachel, when Ascension in Murfreesboro, Ascension Hospital, we were getting calls and reports that they were not providing rape exams. And Murfreesboro is a college town. We got MTSU with, I don't even know how many students are there now. It was 27,000 when I was there, but I'm sure it's grown significantly since. Um, so you've got a big college town, and the local ER is not providing rape kits. So when we started getting calls and referrals in Nashville, we asked why. We reached out to officials at the hospital, and we learned that they did not have SANE nurses on staff. One of their SANE nurses went on maternity leave, and the other one had left for another job. So they didn't have the nurse examiners to actually perform these assaults. And I think that's, the law doesn't require or actually perform the kits for these assaults. The law doesn't require that each hospital have a SANE nurse. So it really is an accessibility issue, especially if you're out in a rural county. Murfreesboro was referring to SAC and even weren't they giving Uber credits or Lyft credits for victims? If you're a victim in a college and you're showing up at an ER at 2 a.m. and they're saying, sorry, we don't have a SANE nurse, but here's a Lyft credit. Can you Uber all the way to Nashville? Even worse, if you hit rush hour traffic, that's an hour Uber ride. So there's a lot of barriers as far as accessibility for providers that can actually perform the exams. And Senator Campbell, I don't know if you want to jump in on any of that either.
Yeah, so we were talking earlier about this, and a follow up to this legislation might be actually to look at finding ways to fund or facilitate SANE nurse training, which I think is different for pediatric versus teenage nurses, and I think, as I understand it, requires roughly 40 hours of training. I think there are two categories. There's adult adolescents and pediatric. And, we are becoming every single year more and more of a healthcare desert in certain areas of our state. And so obviously this, bill and making rape kits accessible to teenagers is important, but obviously we also have to be cognizant of the fact that there need to be people who can actually perform those processes.
Yeah. Senator Campbell, on that note, could you walk us through the proposed legislation that you and Representative Freeman attempted to pass this past year and what that might change?
Yeah, so our bill, Senate Bill 920 and I think House Bill 679, was just a very simple, we always say that in the legislature. This is such a simple bill, but this really was a technical amendment to the 2024 Families Rights and Responsibilities Act that just clarified that minors may receive a forensic sexual assault exam without parental consent or cost. And the reason that we felt that was necessary, arguably this is already legal. We certainly have people doing it, but there was a lot of ambiguity. And by the way, has been a lot of ambiguity, not just in this realm, but in other realms regarding our predisposition towards the mature minor doctrine. And it's had a chilling effect on the health community. And because of that, as Heather pointed out, there are some clinics that do this and some that don't. And we wanted to pass legislation to clarify that all clinics should be providing those services and that it should be available to all teenage girls. And it had unanimous support. It should not be a partisan issue. I think most people agree that teenage girls who have been raped should be able to access these rape kit services. But we'll get into sort of how the process of the bill played out for sure.
Well, I think that would be great just to continue on that path. There were obviously some challenges and some resistance to getting the bill passed. Do you want to speak a little bit about some of those specific challenges or the resistance that did come up?
Yes. So this was a really weird bill, guys. What happened? I have never seen it happen. I've been in the legislature for 5 years. Moreover, my colleagues who have been there for decades had not seen this happen, which was that this bill passed unanimously out of every single committee and out of the floor in the House. The leader in the House, the Republican leader, actually stood up in committee and said, or spoke up in committee and said that this was a great bill. It was really just you know, there was no issue with it at all. And then I passed it unanimously out of committee and had a couple of my colleagues in the Senate tell me that they really loved this bill after committee. And then we got to the floor and we had put it on notice in the Senate several weeks before session was over, about a month actually. And it kept getting pushed back and pushed back. I don't think that was intentional. I think that just had to do with, juggling a bunch of bills. But it was on the last day that we were actually hearing this bill of our Senate session for this year. And right before we were about to vote on the bill, one of my colleagues got up and said that he was very uncomfortable with the parental rights component of this legislation, and that he didn't want his daughter to perceive that she had been raped at school and go see a nurse, and if she hadn't been raped, get a rape kit examination without his understanding or consent, which really is, first of all, wouldn't happen. That wouldn't be legal. But, secondly, it's such a, convoluted case to bring up. I pointed out that this was not, a bill that would affect that case, and that, it had unanimous support, and they proceeded to push it off until next session, which means that all of the teenage girls in areas where clinics are not performing those services for them will go another year without being able to access those services. And it's harmful and unnecessary, considering that there's unanimous support. And I've heard subsequent to that incident that the senator who opposed it said that he actually now understands it and would support it. Now, the reason it's not unheard of for people to disagree with legislation, of course, and to want to get clarification on things. What is very strange and doesn't happen very often, unless it's one of the hot button issues that we all hear about constantly in the news, and this is not one of those. What is not normal is for them to, at the last minute, sort of dive bomb you with some kind of a non sequitur and kill the bill. So it was a shocking moment for all of us, and of course, inevitably, we worry because this is obviously trying to help girls who have been raped.
Yeah, there were certainly several unique challenges that came up at the very last minute, and it was extremely disheartening. And I know that you and your colleagues in the House poured a lot of time and energy into this, and we thought it was going to get passed. And to the point that you just made, in many places across the state, the teens who might need this care right now may or may not get it. And not only is a safe exam evidence collection, but it also helps identify whether or not there are any other physical or medical concerns, and it treats for STDs. So the long-term negative repercussions of this are far reaching, and that's concerning.
And I think it's so important that you point that out, because it's time sensitive. I mean, this data needs to be gathered immediately after the incident, as soon as possible. And so, you can't waste time on these things. And so first of all, as you pointed out, sometimes, parents or family members are involved with these things. But secondly, anything you do to interject time barriers is going to make it less likely that you're getting the data that you need.
Yes, because this evidence has to be collected within 7 to 10 days, depending on the type of assault it was, and that's not a lot of time. So Heather, what happens in practice today if a minor shows up? And when we talk about minors, we're obviously talking about all children and teens under the age of 18, but the rape exam process is really more specific to teenagers, and there are separate practices for children. So I think that's important to note too. But Heather, what's happening now when a minor shows up and doesn't have parental consent?
Yeah, if I could just real quick, just kind of piggyback on some of that legislative process conversation. I just had one other thought I wanted to throw in, which was, we did have such good success in the House. We flew through 94 members voting who were present. There wasn't much debate. The House really got this. But when we got to the Senate floor, that parental rights piece, this was really, surprising. I think that the pushback and the clash with this parental rights doctrine, and we know that parental rights is a big issue, especially for the GOP right now, and with the Family Rights and Responsibilities Act. But the parental rights issue really kind of, yeah, caught us off guard. That senator also made some tweets about parental rights and people accusing parents. So I think that piece we weren't prepared for because that discussion did not happen in the House. And again, it was so late in the game. But I did just want to highlight that this legislation would in no way have impacted parental notification. And we tried to stress that in the final hours of the bill, that this is simply making it clear that a minor can access a rape kit without parental consent. Now, when that happens, these providers are still mandatory reporters, right? They're going to contact DCS, they're going to contact law enforcement. Parents are going to be notified. What we don't want is a parent coming in and vetoing a minor's ability to access a rape kit because they're protecting a potential perpetrator, right? And so try to emphasize that to the legislators that we are changing the process of parental notification. Parents will, of course, be involved as they were previously. We just want to make sure that the minors have access to that time-sensitive evidence collection and that there's nothing impeding their ability to get a rape kit. So I just wanted to note that because, yeah, the parental conversation was kind of thrown in the last minute. Then, of course, we had all those procedural issues where we tried to revive it the last day, but the committee was already closed down, and so it really just was an unfortunate run of events. But as far as today, when a minor is presenting, again, it goes back to the setting in which they're presenting. If a minor, and it can play out different ways. If a minor's at a hospital and law enforcement or DCS is called, then that minor can get the access at the hospital setting, or it can be transferred to our kids or a child advocacy center. And when DCS is called in, the minor is in state custody. So DCS has the ability to consent to that exam being done. So those and law enforcement, of course, that's the investigatory process. They're investigating a crime, so they have abilities to help with the facilitation of these kits as well. So there are certainly minors getting rape kits right now. It's just some of these other avenues where if you're a 15-year-old or a 16-year-old walking into an off-site clinic, off-site of a medical center, a standalone clinic, you're walking in with your cousin, that clinic may not be able to serve you without parental consent. In fact, I was in Chattanooga last month giving a presentation to the Tennessee Coalition to End Domestic and Sexual Violence about the new laws that passed. And I met with the same nurse from East Tennessee from this clinic. She said, yeah, we're not doing them. And I said, well, what are y'all doing if you have a minor show up? We're referring them to the hospital, the ER. And then if there's a same nurse available, hopefully they'll get that kit. But if not, there's no guarantee that that emergency room that child shows up to will have a sane nurse. They might be referred out to the sexual assault center, which is hours away. So that goes back to the sane nurse accessibility. But the director of that center was very clear, that sane nurse, sorry, director was very clear. She said, our attorney said not to do it without an explicit exception in the law. So while you may be able to get a rape kit as a minor at an emergency room, maybe if they have a sane nurse, or you may be able to get one if you have started the criminal investigation process and you're working with law enforcement and you're working with DCS, you might be able to get a referral to our kids or the CACs. There are certainly circumstances where if you're a 15-year-old, you're a 17, 16-year-old, walking into a clinic, you might be denied under the basis of this new Family Rights and Responsibilities Act if you do not have parental consent, because it's not clear in the law that you have a right to that treatment without your parents' permission. So it really just depends. I hate saying that as a lawyer, it depends. But that is the answer. And we see clinics saying very flat out their attorneys have advised them not to perform these until there's a change in the law.
Hey, Heather, for perspective, I think I remember it being just a few states that actually had any ambiguity about this at all. It's only, what, 3 states? How many states is this even a problem?
Yeah, I just remember looking, there weren't a lot of states that I could find that had an explicit exception in their law. And I don't know what those parental rights around medical treatment look like. I don't know if they rely on the mature minor doctrine. As you can tell, it's a very convoluted area with case law and state law. There were, I think, 3 states that I was able to find that had an explicit exception. I know New York was one. Maybe it was Virginia. I did find a couple where they were just clearly writing it into the law, so there wasn't any confusion.
And my understanding when we were working on this was that the only states where this was actually there was any consideration that you might legally restrict minors' access to rape kits without parental approval would be in Tennessee, Alabama, and Wisconsin. So as I understand it, this is, there's a very, small handful of clinics and states in which this is even an issue.
Right. This is not a massive nationwide problem. This is fairly unique, and the Families' Rights and Responsibilities Act has really put a undue burden on teen survivors and sexual assault clinics who provide these exams. You've shared some examples, both of you, but Heather or Senator Campbell, do either of you have other like real life examples that you can share with us that might further illustrate the specific impact that this has on a teen?
Yeah, I can give one example, one story that was recently provided to a provider I was working with. And of course, I'm sure there are stories happening all across the state. How do you kind of collect that data, right? But we did get a call. I represent many victim service providers, and one of our service providers got a call a couple months ago about a minor in Columbia, Tennessee, who unfortunately was denied a rape exam, didn't have parental consent, was denied a rape exam, and became pregnant. For those of you that don't know, the rape exams have Plan B emergency contraceptives, as well as STD treatments and other medical treatments along for those injuries. And this minor was not able to access that rape kit. So they unfortunately became pregnant. They were raped by their father, and they showed up in a Columbia court asking the court to grant them permission to leave the state to get an abortion. So they did not have to continue a pregnancy that was conceived by rape of their father. So we get a call about that. At this point, it's too late for a rape kit. It's too late for any kind of emergency contraceptives. And this person was looking for permission to travel out of state legally because of other laws that have passed in our state to be able to terminate that pregnancy and not have to carry to term her rapist's father's child. Which, there's a lot of medical complications with that as well, and medical considerations for that survivor. But, ultimately, I checked back in a few months later and was never really given a clear answer. I hope that young minor in Columbia was able to connect with organizations around transportation and permission and help and assistance and get the care she needed. But that was one of the very unfortunate ones that was a direct result of not getting a rape kit, not getting a plan B, becoming impregnated by a father. And this minor, I mean, can you imagine a minor having to show up to court and ask for permission from the court to get the health care you need resulting from a rape? It was very unfortunate and heartbreaking. And who knows how often that's happening across the state, with these unclear laws on the books.
It's so important too, because I mean, people have said, as we've discussed this bill, how, that surely that never happens, that a father rapes his child. And, it came up, but certainly when we were talking about, other issues relative to, women's reproductive rights, in the Senate. I remember specific discussions on the floor, and there are all kinds of, excuses that people make that this doesn't happen. And here you have an example in Tennessee where this has happened. And like you said, who knows how often this happens, because obviously there are all kinds of barriers to reporting on these things, and mental health and all kinds of issues play into it. But when you put children in a situation where they can't access the health care that they need, and the parent has been involved with the abuse, then you're creating an impossible dynamic for that kid.
And Senator Campbell, to your point, this is so much more prevalent than I think we want to believe that it is. I mean, national statistics are that 1 in 4 girls and 1 in 6 boys will experience sexual assault before they turn 18. 1 in 6 women experience sexual assault or rape or attempted rape at some point in their lifetime. And most offenders are known to the victim. So there's so many reasons why this is important, and it's difficult to paint a super clear picture of how big the problem is, because we can't capture the people who are not getting the care that they need. And that's one of the things that makes this even more challenging, and why I think it's so important that we continue to try and be proactive with this, because what we're trying to do is prevent people from experiencing the undue, unnecessary harms that this legislation unintentionally is causing. So Senator Campbell, what are some of the key changes that you think we should be planning for in the next legislative session to get this across the finish line?
I don't think actually there needs to be much changed about this legislation, because it does have unanimous support. As we said, it passed completely through every single committee in the House, where, just FYI, in case you don't know this, most of the drama is in the legislature. And this was really a blindside. And we've had the senator who instigated the opposition to this subsequently tell us that he supports it and just did not understand it. But I do think that that with great caution, we need to make sure that everybody fully understands it and is on board with it. And also make sure that it gets run early, because we tried to do that this last session, but we certainly didn't start at the very beginning of session. This should be a bill at this point that I would think we could introduce, and I think it was calendared actually for the first committee of next session, to go back to the health committee. Was it health or judiciary? Judiciary. Yeah, yeah. And so I think that we need to just be on top of making sure that we're running that legislation. I'll let people who are much more legally qualified than I am take another look at it, and I'm sure Heather will be doing that to see if there are any changes that we need to make it as effective as possible, and to get it across the finish line. But my hope is that we can get it over the finish line early on next session, because it's got unanimous and bipartisan support.
And Heather, I want to pose the same question to you. What do you think, from your perspective and your vantage point, what needs to happen to get this across the finish line?
Yeah, I would definitely say, going back to these Senate lawmakers who posed the questions and didn't understand the bill on the floor and really didn't give it a fair fighting chance, in my opinion. They had these questions, these hypotheticals, and immediately had a motion queued up to send it back to committee. I think getting to them early and educating them on the issue. The senator who stood up and shared the story, we did have his local sexual assault response team reach out to him. And so we had him go sit down with the local sexual assault advocates in the community, and they asked him, why this bill didn't pass. And they shared with him the perspectives of the detectives and people who are working with these crime victims, and and explaining to him the importance of why we needed this law. So I think definitely going back and educating each one of these, the lawmakers who are maybe confused, and combating some of the parental rights notification misinformation. But I think a big piece of this too is to ensure that the parental rights confusion and some of the confusion around the bill doesn't derail us again next year. I think we do need to show strong support from experts in the field. We'll certainly be targeting Senate leadership as well as the members on judiciary and the members who had questions on the floor. But really having a strong community response will do, I think doing calls to action and having people who are either legal representation of minors who are navigating the criminal system, or healthcare providers. I know we have some SANE nurses on the call. So anyone who can reach out directly to their legislator and say, we need to add this in, it needs to happen immediately. We might want to amend it if it's not already going into effect upon signature. Senator Campbell didn't think about the effect date. We should look at that. We should pass this thing immediately when we get in, so that no other survivor, has to jump through these hoops and try to navigate this very complex legal system and landscape. But having people show their support and use their voice and their expertise to let lawmakers know this is needed and really demonstrate community support around it.
And Heather and Senator Campbell, in addition to educating lawmakers and continuing to um, have a voice on the Hill and share concerns and reasons why this is so important, are there other things that you can think of that legal professionals or medical professionals or any of us can do from a public educational perspective? Is there more that needs to be done in educating the general public about this issue?
I think as we're seeing healthcare in general be diminished in our state through funding, and we're about to see a lot more of that, and specifically around issues where our most vulnerable populations, like teenage girls who have been raped, are seeing challenges. The more that we can do in a non-legislative capacity to show up for these people, the better off we're going to be. And just in general, when people come to me, and they do all the time, and say, oh my gosh, this is kind of a crazy environment, what can I do? I say, there are so many, like Sexual Assault Center and this space, and certainly many others in other spaces, people who are doing the hard work of helping people in these environments. And I think that we need to do everything we can to support, fund, and empower those organizations, because sometimes government's not the answer. And certainly in Tennessee, around these kinds of issues, I think government is not really going to be showing up for us anytime soon. We need to continue to try to do these small remedies and anything prophylactic that we can do to protect women and children from sexual violence. And we also need, as individuals, as lawyers, as legislators, as business people, to actively support organizations that are doing the hard work of helping people through these sorts of things, because we do have, and we're going to continue to see it get worse, healthcare deserts and areas, as Heather and I were talking before this call about, where we don't even have SANE nurses available. And I I don't know a lot about the SANE nurse process. I know there's some SANE nurses on this call, as Heather said. But I also think that from a legislative standpoint, looking at maybe ways to support and catalyze training for that is a good idea. And she and I and you, Rachel, hopefully will be looking into whether or not there are some options for doing that.
Yeah, I think those are some excellent ideas and excellent ways that we can all try and further this. So would it be wrong or correct to say that this is this part of a greater trend in some healthcare concerns that we're seeing right now in our state?
Yeah, I really started to see it. I got elected in 2020 in the middle of COVID. And so I came in, right when we were dealing with all the vaccination issues and Shelley Fiscus, and you guys probably, many of you remember all of that. And so we've seen this real push against science, against medicine. We have doctors and scientists and professors leaving our state because they don't feel supported here and they don't feel comfortable about what the requirements and understanding is around their practice of medicine and their commitment to their patients. They feel a chilling effect about especially women's reproductive issues, but also, sexual assault and all kinds of issues that have to do with supporting their patients. And so I think that this is part of a trend, and we see questions around all kinds of issues. Because we also do this a lot. We pass ambiguous legislation and we pass unfunded mandates a lot. We see this in the gun violence space quite clearly with passage of laws that are ostensibly meant to assess or to address mental health issues and things like that, but really are just creating an unfunded mandate for our prisons being able to provide beds and support for people. And certainly we see this in this area where the state is not making it clear, and that's sort of the genesis of this entire conversation, whether or not teenagers can access the healthcare they need. And so I think this continues to be a trend. I think that's partially by design and partially comes from a lack of focus on, making it very clear what these laws that are being passed are. But I don't see that trend and ending anytime soon. I think we're going to continue to see issues like this.
Yeah. And it can be paralyzing for the professionals involved. We don't know, Heather and I were chatting, we don't know what the repercussions could be, what the liability issues could be. Let's say if a provider performs an exam without parental consent and the parents attempt to sue. We don't know what the fallout of that would look like for the provider, but we do know that it's debilitating to providers. And sometimes just the fear is enough to not provide the care that is needed. So that's another concern.
And I'm
Rachel,
glad you focused on that because fear is really sort of the core issue here. Seeing providers who are scared. I'm sure that all of these people would like to be able to provide these services, but it is fear about the fallout. And we shouldn't. Come on, guys. We don't need to have providers who are out there helping Tennesseans living in fear as to whether or not they can provide medical care. That's not okay.
And I was just going to piggyback on that point about the ambiguity in statute and the fear of providers. When we were having these conversations in the House, it was something that came up, and we were meeting with members, and a lot of them were saying, "Well, they can already do this by law," and we were kind of going back and forth on the interpretations and why clinics were interpreting it differently. And there was a comment made about, well, courts would side with providers, and I said, that's great that we think there's enough protection in current law and case law and that a court would side with the providers. Providers aren't going to do it if they think they're going to be at risk of litigation. They're not going to do it if they think they can be sued and that the law doesn't specifically allow for this. So it's not that there aren't protections in the law, it's just there aren't explicit protections in statute. The case law is muddy, mature minor doctrine is getting narrowed and limited. So people want clear understandings about what their liability and risk is. So yeah, a court may side with them and allow them to provide kits to rape kits to minors. But what if they're not even going to perform the kits if they think they could be sued? So we need very clear laws. There's no reason to not explicitly put in statute that you have a right to a rape kit. And if you're a minor, you also have a right, and it shouldn't be impeded by someone's ability to veto whether or not you get access to that care. So I think just putting in there clearly, protecting our providers and making sure that victims can access this care is crucial. And thank you, Senator, for being willing to kind of take on the fight.
Of course. Thank you. Thank you for working on this with me. It's so important to me. I also wanted to point out, we've talked a lot about whether or not a parent was involved in the sexual abuse, but let's just keep in mind that teenagers are also sometimes very reluctant to tell their parents about things like this, that there's so much shame and fear and all kinds of issues around this that that we need to protect children when they're, you know, in a situation like this from having to worry about that at that moment when they need to gather the evidence that can protect them in the future and work those things out, you know, later.
Yeah. Yeah, I think that's a perfect point that's important to reiterate. And I know it's been said already, but collecting the evidence, going through the exam process does not mean anything more than getting the immediate emergency care around this. It does not commit you or a family member or anybody to filing a police report. You can do this without filing a police report. It doesn't commit anybody to following through with it within the criminal justice process. It is simply gathering the evidence that is only available for 7 to 10 days and collecting that evidence so that it can be used if you decide to do something with it. And then making sure that there aren't any other emergent medical needs that that are that are urgent. So you don't have to make any decisions, but I think y'all have also pointed out though that when it is a minor, it is still reported to DCS, to parents. So this doesn't change any of that mandated statutes.
Reporting process, yeah. Rachel, also just want to note and tag on to that. We have great resources out there. I see we have an advocate in the chat who's cross-training in sexual assault advocacy. And if you go to tncoalition.org, they have sexual assault bench cards. They have domestic violence bench cards, and those bench cards list the statutes and laws that are on the books, as confusing as some of them might be in the moment. So if you need a reference to statutes, those resources are available at the tncoalition.org website.
So I know we're running close to the end of our time together, and I have 2 final questions for each of you. The first is, and whoever wants to go first, Heather or Senator Campbell, the first is, what specific call to action do you have for those of us here today, whether you're an attorney, whether you are in the legal profession or in another profession? What can we do? What call to action do you have for us leaving this meeting?
Yeah, I have one.
Well,
Or go ahead, Senator.
I was just going to say, you know, going back to what I was saying earlier about supporting the people who are doing this work, I really do encourage people, and I do this on a regular basis, to support the Sexual Assault Center. You guys have done such an amazing job at helping women and save lives, you know, since your inception. And as we have seen with recent legislation, it's more and more important to empower and fund and support organizations like yours. So I always go to the Mad Hatter dinner, and I'm, you know, obviously going to do everything I can to continue to support that. That's definitely one thing anybody can do.
And we are so grateful for your support, Senator Campbell. Thank you. And encourage anybody to get involved with us or one of the other programs across the state that do incredible work. Heather, what about you?
Yeah, to tag on to Senator Campbell's recommendation about getting involved, I believe you can sign up for, legislative alerts, emails. Sexual Assault Center sends a lot of those call to actions out during legislative session with scripts and Day on the Hill information to tell you how to get plugged in. So support these organizations, but also sign up for the alerts and come to the Days on the Hill. And we have about 22, 21 people on this call. Every one of you have a senator that represents you directly as a constituent. So after this call, typing up an email and saying to your senator, I'm a constituent from your district. I just got off a CLE training on this specific issue. Please support Senate Bill 920 next year. Please sign on to it if you would be willing. And don't stop at senators. I don't know how many of you on this call are represented by Senator Campbell, but don't stop with your direct lawmaker. Do your lawmaker, and then senators on the Judiciary Committee, Senate leadership. Those are the people I would target. But every one of you right now can email your direct representative in the Senate, and they will listen to your voice because you're a constituent, and they will prioritize that voice and that opinion when it comes in. So emailing your direct senator, if we could get 22 emails out to senators today, that would be pretty incredible. The other thing that I think lawyers can do specifically is join a board, get involved with these organizations out in the local community, especially in the rural counties. I know Sexual Assault Center has a lawyer that sits on their board that we consult with often. A lot of people hire in-house counsel as well, but if you can join a board, if you have an expertise in law and legal and you can help advise and interpret some of these statutes, join a board and help some of these nonprofits navigate the legal landscape.
Perfect. Wonderful suggestions. Thank you, Heather. Okay, final question before we end today. Senator Campbell, what gives you hope that this will pass, and what gives you hope and the energy to keep moving forward?
Well, I feel that the senator, I know that the senator who stopped this feels bad that he kind of jumped in and put a wrench in the works because he told me that he did, and he apologized for doing this. And moreover, we had a bunch of senators on the Republican side, and this never happens, actually trying to rally groups of senators to have it brought up for reconsideration after that happened. So I know that there is a lot of support for this, but I'm not going to take it for granted and make sure that I talk to them myself as well before this comes up again, because, obviously this is not about us. This is about teenage girls and making sure that they have, and boys, and making sure that they have the health care that they need. So I am hopeful, very hopeful, that we'll be able to early on next session get this across the finish line. But please do give us all the help you can. And what gives me hope in general is I think that there are a lot of great, amazing people in this state doing really hard work outside of the political realm, which the political realm is kind of, I think we could all on this call agree, kind of caustic right now on both sides. And so I think that there are a lot of people who are doing the work that's really helping people in the nonprofit sector. And also, I am just blown away by kids, and the burgeoning generation and their enthusiasm and commitment to change and to trying to address some of these issues. So I am actually very optimistic that we're going to be able to make a difference.
It's very good to hear.
Mm.
Heather, what about you? What gives you hope that this will pass, and what gives you hope to continue to move forward with a lot of these big, heavy lifts?
Yeah, I think my hope comes in all the people that showed up on this call and the people who care and do the work. I am anticipating a little debate on this, Senator, in the judiciary. It's easy for people to say, oh, yeah, it'll pass. We are not opposed to it, because who wants to say they're opposed to something like this? I do think there will be some discussion around parental rights and notification. And so I trust the experts and the people in this field and the people that the senator and I are working with on this legislation, including SAC and their many experts, that they'll be able to come up and give examples and educate lawmakers, and that we can amplify their voice so that these senators will understand the need for this. So I have hope on the people on the ground doing the work, the people who advocate and show up and care, that we can amplify and turn up the volume on that in the Senate, so it's clear to these lawmakers that why we need to get this bill passed.
Well, thank you all. Thank you for being here, Heather and Senator Campbell, for sharing your thoughts, your experiences, your expertise. And I hope that everyone knows that your voice has the ability to be very powerful, and please continue to use it, to share it, and to help us advocate for good legislation like this. So thank you all. Zach, I'm going to turn it back to you.
All right. Thank you, Rachel. And thank you, everyone. I certainly learned quite a bit. That was quite great. So folks, just remember, we will get it turned in for your CLEs if you were registered for that today. And if you go to WPCTN.com, you can find our future lunch and learns that we're doing. And thanks again to our wonderful panelists. And by the way, while I have the ear of my state senator, I want to ask her to support SB 920. But either way, thank y'all all, and y'all have a great rest of your afternoon.
Thank y'all.